Hello everyone, welcome back to my channel, Smile Through It All. Today we have a very special but yet personal and sensitive topic about Aniket's journey with leukemia and the stem cell transplant. We would like to make a video basically for awareness and also to track the journey that we have been through. And we would also like to keep it very raw. So I have a bunch of questions here that I would like to ask Aniket, and maybe he answers. And we also talk about our experience through this vlog. I hope you like it and watch. I hope you also watch through till the end. And if you have any questions, or if you know anyone else in your family or friend circle that is going through the same, maybe you have some inputs from us, maybe it helps you all through the journey, or maybe it's just information that you can have in terms of avoiding the same situation or early detection in this case. So yeah, here we go. Hi Aniket, welcome to the channel.
Hello Spurti, good to be here.
Thank you. And I have a few questions for you, basically about your journey with leukemia and how we have dealt with it so far. So when did you first get detected and what were your symptoms?
So I was first detected in the November of 2021. In my case, I got lucky because it was an early detection. I got a fever and some swelling on the right side of my neck. And as usual, we went to the doctor and I got some antibiotics to get it treated. We got it for a week, I think. And but even after that, we did not see any improvements there.
Yeah,
And
so
that is when we went to a different doctor, and then it got escalated a little because nobody could figure out what was going on. And that's when we went to the big hospital. It's called the Heidelberg University Hospital. And that's where they did a blood test, and they immediately found out that something is not right.
Yeah, so it was a normal swelling here behind your ear, right? The one that usually swells up when you have a very bad cold.
Yes.
Yeah, so that was how it started.
Yes, correct.
Yeah, and I also remember during that time you also were running quite a lot and you were aiming at losing weight. And it was not just because of running, it was also the cancer that led to, the loss of weight, right?
Yes, I would say so. So just the loss of weight, I was happy with it, that I was losing the weight that I wanted to. But the problem was also my energy level started going low with time. Like every other day, I could notice that I had to sleep more and I could not do all the activities that I wanted to do. And that's when the alarm bell started ringing, and we went through all the steps.
Yeah. And to be honest, we also have a doctor in the family. My sister is a doctor, and we told her that he was losing weight. So we attended a function there. A lot of people started noticing that Aniket had lost a lot of weight, and we were proud that his running was working out. But then the downside was the loss of energy. And we mentioned this to my sister, who's a doctor. She also mentioned that it's better that he takes a blood test. So when the antibiotics did not work, the GP as well as my sister recommended that we take a blood test. And that's when everything went downhill. Yeah, you mentioned your symptoms. How was it to get admitted? Did you have some time between the detection in terms of the blood report? Did you immediately know it was cancer? What was it, the first?
So what happened after the blood test was they could immediately tell that it's cancer, because it had all the telltale signs of leukemia or blood cancer. And yeah, I was given 1 hour to go home, pack my things, and come back and get admitted immediately. What was really good that they rushed me into this and asked me to get back to the hospital immediately so that they can already start the process, because it was an early detection. And the more they delayed, or the more I delayed, things could just get worse.
Yeah, but they also kind of could not narrow it down exactly to leukemia, right? They were also suspecting tuberculosis immediately when the counts were really high, but we knew that it was not the regular cold.
Yeah, that's true.
Yeah. So that's when, and do you remember that was the WBC count?
It's always the WBC count which goes up. So the basic concept of any form of cancer is the cells the regular cells start multiplying and they become premature cells, and it just multiplies much faster than the normal cells. And in my case, the count was almost 100 times more than what it should be, and that was already a clear sign that something was not right. Yeah, it just took them a couple of hours, I think, to make sure that this is leukemia, but to make out what form of leukemia it is. So there are many forms of leukemia. What I had was called ALL. What I had was AML. Thank you. ALL is another chronic form of leukemia. So what I had was supposed to be a low risk form of leukemia. And to confirm what kind it is and what genetic factors have caused it, for that they had to do a bone marrow check. So they basically go into the pelvic bone and they take out a part of the sample of the bone marrow, and then they do some tests on it, and that is where they can clearly point out and say what is going wrong and what kind of treatment would match or help cure this disease.
Thank you. So when and where were you admitted? Why did you choose that? Why did you choose to get admitted here in Germany, and why this hospital? And what was the prognosis? I mean, what stage of the leukemia did you have? Any background on these?
Like I said, it was in the early stages. I was never told what stage it exactly is, but then since I've had the symptoms only for just a week, so it was pretty early detection, thankfully. For us, because we live around the Heidelberg area, and the Heidelberg University Hospital is probably the most famous one. That was our default go-to hospital. And also, when I went in for the check, it was late in the evening. I think it was around 5 o'clock in the evening already. And by this time, most of the clinics at least are closed, and I went into the emergency. So that was the only thing that was open. Then what else did you
Yeah, why Germany?
Yeah, for me it was obvious because I live here.
Yeah.
But the question came in later, at a much later point of time, when I had to go through other procedures. If I wanted to shift to India, but then there are a lot of advantages that you will get if you unfortunately get the disease, but then if you were in Germany when it happened. One of them is the insurance takes care of everything, including your treatments, including your medicines. You just have to pay a maximum of 10 euros for any of the medicines that you buy in the pharmacy. But whatever you pay, whatever you are treated in the hospital, whatever medication that you get, that is all included. The stay was, sometimes I got a semi-private room, sometimes I got a private room, depending on the availability. And that was also extremely cheap. It was 10 euros a day. Something was the charge, which is next to nothing. And the most important is the advancement in the research and development that most hospitals in Germany have. But speaking about Heidelberg, it is one of the most advanced in cancer research, especially related to oncology. And it was just luck, it was just God's plan that we ended up being in this region. About 30 kilometers, 25 kilometers from the hospital when I got detected. And yeah, that was also very easy for Spurti back then, because we had an 11-month-old baby, and our whole life was turned topsy-turvy. But yeah, in general, to speak of why the treatment here was good was also that the care I received in the hospital was amazing. The nurses, the doctors, everyone was super friendly, and they were extremely transparent with me. Everything was explained to me, to Spurti, about what the next steps are, or our opinion was taken sometimes. And also my sister-in-law, being a doctor practicing here in Germany, she was also, her opinion was also considered, because she could also call the doctors directly in my area, whichever station I was admitted in, and she could also communicate things. And yeah, it was something that I got really lucky with to get treated here.
Yeah, just to add in here, if somebody is detected in Germany, not just with cancer, any major illness, for the family, it's very important to get a Patientenverfügung. and a Versauger marked, right? So that is Aniket giving me as a spouse permission to know his medical records. So here, medical records are very personal, and if your family or your immediate family or somebody else has to take medical decisions based on you, it was very important that we had this document. Otherwise, everything was only through him, and there would be times that he is not conscious, or decisions cannot be made only by himself. Then this kind of helps you. And I think we got this done through a notar. That's the notary here in Germany. And we added both me and my sister into it. That took quite some time, but he was already admitted by then. But the doctors, out of goodwill, were already informing us about things. But yeah, while he was getting admitted, the first check, when you produce your health insurance card, they also check, do you have this document, and whether Aniket gives me the permission to know more details about his health.
That's right.
Yeah. Okay. What was the treatment that they suggested for leukemia or AML in particular, like in the beginning?
For me, it was after the detection, it was still considered a low risk cancer. So that means they thought the prognosis was pretty good, and they thought 5 rounds of chemotherapy would suffice. It also depends on the age of the patient. It depends on what preconditions they already have. All of these factors come into picture to decide the dose of the medication, to decide how many rounds of chemo to do. And since I was pretty young when I was detected, compared to the other patients who come in there, I was given the fully loaded treatment. And so it was 5 rounds of chemotherapy and each therapy lasted for a week. And after a week, I could go home for about 2 to 3 days. That is when the drug really hits you, and it basically kills all the white blood cells in your body, which is the aim.
Along with normal cells.
All the white blood cells, let's say the good and the bad ones.
Yeah.
The aim of that is to keep repeating this cycle, so that at some point your bone marrow or your stem cells stop producing the bad cells. I think that is what I assume. So, but then what happens in 2 or 3 days after the chemo session ends is you lose all your white blood cells, but also you are prone to infections. That is when you have to go back to the hospital and stay there approximately 2.5 to 3 weeks. This is when you are bound to get some sort of minor or major infections, you never know, which almost always leads to a fever, and then they treat it. Sometimes they know what the infection is, they can detect it, sometimes they cannot. But the point is you recover, and then your white blood cell count again goes up. So once it reaches a certain point, then you can get a break. I used to get a break of about 1 week to 10 days and then start the new cycle again. So this went on for approximately 4.5 to 5 months. Yeah, and then by the end of it, after the 5 rounds, and every month I would get a bone marrow biopsy. And after that, after the 5th round, when they checked, there were 0 blast cells or 0 cancer cells that could be found in my bone marrow. So that was a good news back then.
Everyone is scared of the word chemotherapy. How was it for you? Were you scared? What were the 5 rounds like? And which one was the worst, or which one? How was it for you, basically?
Yeah, there is a lot of taboo around cancer and chemotherapy.
I'm still shivering.
Yeah, it still doesn't sink in even after you've got it, right? It's tough to explain. The good part, let's say, is it doesn't hurt when you're getting the therapy itself. It just flows in through your veins, through the IV. And then you have to drink tons of water, so that it's basically poison that's going into your body. So full of toxins. So you have to flush it out. And the only way to do it is drink tons of water. And that's what I used to do. And yeah, it would just make you extremely weak. You would be prone to infections. You would be stuck to the bed most of the time.
You forgot the hair loss.
There was basically I lost all. So what chemotherapy does is it cannot target only one particular type of blood cells, let's say. It's meant to kill any cells that rapidly multiply in your body. So that is, of course, your white blood cells, but also your hair follicles or your hair growing cells, and in men, of course, the sperms. So the first thing that happened after the chemotherapy, the first chemotherapy, was my hair started falling off, and not just the hair on top of my head, but also my eyebrows, the beard that I had. Yeah, basically everything. And yeah,
Yeah,
that was.
just to add in here, for me, the worst part was I was not allowed to see him because he was prone to a lot of infections. It could be a little bit of dust or dirt from my nails that I touch him and that he could catch things. I think initially they allowed me in the first cycle. The you used to come down to meet me. That was difficult, but also when he came home, I had to be extremely cautious of the food that we prepared for him. Also, he used to be really dizzy. So the chemo made him so dizzy that he happened to fall sometimes, and he got some minor surgeries because it is just a common side effect that you tend to, faint during that time. Yeah, but it's very subjective. Some people experience that. I cannot say that it's a common symptom, but for him, it was a little difficult.
Yeah, there was no, let's say there is no guideline to say that this is how it's going to go. These are the things that side effects that you're going to face, and this is how you handle them, right? With every body type, it changes based on gender, based on your age, based on even ethnicity. I'm guessing there is also certain side effects that can be seen. For example, after chemotherapy, my skin darkened about 2 shades, I think, after chemotherapy, which is obviously not seen in the European, with the Europeans,
Yeah.
or with the white.
Just to add in here, the whiter skin are more prone to skin cancer. The darker skin, it gets even darker. So
Yeah.
yeah, that was also one of the side effects. Anything else to add there? And yeah, after the chemo, did you recover? How was it after the 5 sets of chemo?
Yeah, the recovery was actually not too bad. Maybe you have a better idea. I don't, it's more of a blur for me.
I just remember the fifth chemo or the last 2 sets of chemo, the dosage was really high. So it was more intense, and that was the time when he had extreme dizziness, a lot of infections, and we need to be extremely careful, especially when he was back home. It was difficult for a day-to-day activity. Even going to the restroom, he needed help. I mean, somebody to support, because we never knew when, he would get dizzy again. He could not eat everything. He needed very bland food. So our normal Indian diet did not work for him a lot of times. But apart from that, there were some fruits as well. Things like avocado that used to work very well earlier did not work at some point. We also tried to give him a lot of dragon fruit because it is believed that it would help with cancer. So that used to work. It was on and off.
Also, because of the treatment, I had to take a lot of supplements, vitamin supplements. I was also recommended some protein shakes, energy drinks by my doctor because I did lose quite some weight during this entire session, and the fastest way to give me energy was energy drinks, but especially doctor recommended one. Yeah, I think.
Yeah, after the chemo, I think a few months later, you did really well. We even celebrated, went to a couple of, we traveled to Amsterdam and so on. How did you know that the cancer was coming back, or what happened later after this point?
Yeah, I think we went to Turkey for almost 10 days after that. I could even feel my energy coming back, like on a weekly basis. I could see the difference. And I still used to get bone marrow biopsies. It was beginning every month, and then it changed to once in 3 months. And to be honest, I could not notice myself that anything was changing.
Yeah.
It was only during the first bone marrow biopsy after 3 months that I got that they could detect something.
It was not the WBCs this time, but it was another count that went up.
Yes,
Yeah.
so I can't seem to remember the name of that, but then this particular value or this entity, once it starts growing, and depending on how fast it grows and how much it grows by the number, they can predict when the cancer cells will start being produced again. And this is what they always look out for whenever they do the biopsy. And when they did that, it was at a very low number for the first time in like 4 or 5 months. And they still wanted to wait and watch if it will go away by itself or not. So they did another bone marrow check in a month. And that is when they saw the value rise by almost by 10 times, I think. And that's when they decided that.
So the cancer was not back, but this value kind of indicated that the cancer would come back at a later point. It could be anytime the next few months, or it could have even taken longer, right?
Yes.
Yeah. So this particular value that he was talking about is not checked everywhere. To be honest, there we were really lucky to be in Heidelberg, because we have relatives who are also hematologists in the US and in India who were kind of actively looking at his records, and they were also like, what is this value? We don't do this kind of check back in India or in the US. It's very nice that the uni clinic is taking care of this. Was it the blast cell value? I think I
Maybe
don't
we
really,
will look it up and then put it in the description.
Yeah, exactly. Yeah, and that's when everything again went downhill. So he started receiving.
So basically, it doesn't. So in this situation, there are only two things that can be done. One is to repeat the chemo sessions, and the other thing is to do a stem cell transplant. So in my case, since the chemotherapy did not work for the first time, so there are zero hopes that it can work again. So the only other alternative is a stem cell transplant. A stem cell transplant is where they take the stem cells or the bone marrow cells from a matching donor, and they insert it into your body. And these stem cells basically will go and replace your current immune system and start producing new cells which are not prone to this genetic mutation which was causing the cancer.
It is one of the best solutions in terms of leukemia, also for some other cancers or other diseases as well. But the possibility to find a matching donor is really difficult. So it is 1 in 1,000 to get even a 50% match. So it could be in one in several lakhs to get a matching donor. And yeah, the first part is where you try with your family. Of course, your parents are a 50% match. Your father or mother can never be a 100% match, because each kid receives 50% from the mother and 50% from the father. And Aniket, being the only child with no siblings, we already knew that he would not have a 1 in 4 match within the immediate family. And yeah, the hospital, of course, tries to get you some donors or matching through a global registry. But we also did several campaigns, and I would like to talk about the whole stem cell journey maybe in another blog. But just as a summary, he got his stem cells from his cousin, and we are here 1 year later. So things have worked out well until now, and I hope it would be the same going forward as well.
Yeah, that's the hope.
Yeah. What was the worst part of the entire journey? Was it the chemo, or the difficulty of finding a donor, or now post-transplant illness? What do you hate the most in the entire thing? I'm laughing at this, but it's just, I know how difficult it is. But knowing you took the entire process in a very humorous way, and you calmed me down as well. So now I'm laughing asking this question, but I'm only glad that you're doing well now.
Yeah. For me, the worst part of all of this was staying away from the family, to be honest. Because you can go through a lot of treatments, but if you have your loved ones next to you, then that reduces half the pain already. Spurti did everything that she can. She used to come and visit me almost every day, be it weekday or weekend. And Liam hadn't started his Kita yet. So he used to be at home initially, and she had to find somebody to take care of him, since kids were not allowed in these areas or in the stations. I have no clue how she managed to do this, but she still tried her best to come visit me, say hello. But for me, it was also that I was missing my 11-month-old kid, not seeing him grow up in these formative years, and that was really painful. Yeah, I mean, for me, what also worked was me being ignorant about a lot of things. Again, this is thanks to Spurti. When I say ignorant, that means I mean that I did not do any research by myself, because Spurti was here to do it. She did everything, did all the background checks with other people who have gone through what I am going through, spoke to all the doctors, found out if the treatment that I'm being given is the best one that's possible. Whether, for example, I had to get a surgery, and if I did not even know this, but then she asked if instead of a junior doctor, a senior doctor can treat me, and she even paid extra for all those things, and I had no clue she was doing this in the background. I only focused on what's coming towards me and how I can get better and then get back home. I did not really think about what the future holds, or over research sometimes burdens you too much, and you forget to handle yourself now and think too much about the future and then lose the confidence. I think that way it was. That was, if I really hope whoever goes through this has somebody like Spurti next to them to support them and to make their journey as easy as possible.
Thank you. Yeah, I do remember talking to some psychologists as well as doctors who always kept telling Aniket's a very positive person, and the word cancer has the word can. So if you have it mentally that you can do it, then you can, of course, be done with this and recover from this. So I think it has a lot to do mentally, and you need your family's support. And knowing too much is sometimes also not good, because you think of the extreme cases and not everything is applicable to you. So we used to handle things, like take it one day at a time, not think about symptoms that he does not have. Of course, used to read, and I would join some Facebook groups related to stem cell transplants or chemo or leukemia in general, but I would not put my head into it unless I am seeing some symptoms in him. But the doctors here are also proactive. They take a lot of measures even before something hits you. So they tell you that the side effect of this medicine is this, and if that happens, then you can take this tablet. So they were also ready with a lot of aspects. And maybe I go to the last question. How was your hospital experience?
Like I mentioned, the hospitals here are pretty clean. The people are very sweet. Since I'm non-vegetarian, so for me the food was also bearable. The dinner part was pretty bad, to be honest. You're served something called as Abendbrot. In German, this means that it's just a piece of bread with either a sausage paste or a liver paste or some dry cheese, which does not go down your throat easy.
Yeah, well as this, one of the side effect was blisters on your tongue. Yes. Which made it even worse when it came to swallowing, right?
Correct. So I needed something that is pasty, that is smooth, and I don't have to chew too much at some point. But then they were sweet enough to accommodate my request, and they gave me like a braai that probably my son would also be eating at that point of time. But as long as I could get the nutrition that I needed, it was fine. Yeah, the doctors were extremely helpful, were extremely friendly. They would come and check every day during the rounds, and they would listen to my questions. The nurses were extremely helpful as well. Any time of the day or the night, they would be there to help me out. I had even a couple of incidents, like Spurti mentioned earlier, that I lost consciousness and I fell down a couple of times, hit my head once on the left on the eyebrow and once on the back of the head, and once more, I don't even remember where. But the moment they came in, they took care of me immediately. Every time I fell, I always got a CT scan. Is it? CT scan.
MRI as well. Yeah.
And an MRI, to make sure that there's no damage, or if there's anything they need to treat it with. Yeah, even now I go for follow-ups. In fact, I think tomorrow or the day after, I have another blood check to make sure that there are to see what medications can be changed, what new things can be brought in terms of supplements and stuff like that. but basically to make sure that everything is stable. And even now, I'm friends with almost everyone in the hospital. Everyone who speaks to me, who sees me, talks to me, is extremely friendly even now, and they welcome me with open arms. So that way, it's become like my second family now. But I wouldn't have it any other way, because going to a place which is cold and which is not very responsive, or which is very indifferent to you, I would prefer this any day.
Yeah, I just wanted to mention the language barrier, right? To be honest, you didn't have a big impact of it because you can converse in German, but maybe for the ones who are new to Germany, who are being detected with this, if you can say something about it.
Yeah, to be honest, when I went in, it wasn't like I was proficient in German.
An extent
Not that I am now either, but I could have basic conversations and put my point across. But people in the university clinic in Heidelberg, at least everyone knows English. And if they realize that you cannot converse at all, then they will do their best to speak to you in English. The doctors, of course, almost everyone knows English. The nurses, it could be that one or two, a couple of them are not very confident, but then most of them will, in every shift, there will be at least a couple of nurses who can talk to you in English and help you out. But I have to say, during this stay, my German got really better, because you spend a lot of time there and there's not much to do. So you also get to sit and talk to them and have conversations and talk about family, about life, about vacations and stuff like that. That way you also pass some time and you also pick up the language. So it was a win-win.
I remember after his stem cell transplant, I usually used to do all the documentation and the talking because my German was slightly better than his. But after the treatment, we happened to visit some German official. I think it was registration of a company or something like this. And he happened to use very fancy German words. And I was like, okay, did you get admitted to the hospital or were you in some language school? It was that good after that.
Yeah. Yeah, but then after that, I lost touch, so I'm back to square one.
No. Yeah, I think that's the end of today's vlog. I would take up the stem cell transplant or other questions on different vlogs. Also, I think we have the nutrition journey and the aftercare, the support that we received from the government or the health insurance, the issues that we faced maybe with the bureaucracy sometimes with respect to the salaries or things like that, and how we dealt with that. But yeah, let me keep that as part 2 or 3. And yeah, thank you for spreading awareness on the topic and good luck.
My pleasure. Thank you so much.
Oh,
Thank you,
bye.
guys. Bye.